Hello, I'm Freddie Coleman, and welcome to this week's episode of the USF Health Brief. Today, we have the opportunity to speak with Morsani College of Medicine Associate Dean of the Department of Medical Education, Dr. Deborah Douay. She will give us some insight on how the medical school staff and faculty have adjusted to the COVID-19 pandemic. Good afternoon, Dr. Douay. Thank you for joining us.
Well, it's great to be here, Freddie.
How have the mechanics of teaching medical students changed since the start of the COVID-19 pandemic?
I won't lie to you, this has not been an easy time. I think this has been incredibly challenging for everybody. The first thing I would have to say is, had we not launched Teams in October, this would have been incredibly painful. And we would have been in a position that a good portion of medical schools found themselves in when this hit. We weathered it much, much better than I think a lot of schools across the country did, because everybody knew how to use Teams. The second thing is, we were not only able to move all of our didactic material onto Teams, we were able to move all of our small group learning onto Teams and a good portion of standardized patient care onto Teams. So there was this, within a week and a half to 2 weeks, this complete transition to all online teaching. I don't think it felt smooth because we were all in the moment, but I think from a big picture perspective went incredibly smoothly.
Much of medical school, I understand, is very, very hands-on, and we've kind of shifted from that hands-on to doing more stuff that's technology-based. How do we still ensure that the students are still getting that same high level of education that they would get?
What we have done is really be strategic and move material around to do the material we can do with high quality online, and then with plans that when we can come back in person, that we will make up some of those in-person things. We really moved towards training our standardized patients instead of being able to have a student interview them on an exam table, having them interview via Teams and mimicking a telehealth visit. And our team was absolutely fantastic. There was, at its peak, we did over 300 hours of standardized patient encounters in 1 week, which this was in the process while other schools were scrambling to put lectures online. So we were way ahead of the game. So the students may not have laid hands on patients in a while, and we definitely are going to have to make up that time and make up those experiences, but they have gotten to practice pretty much every other skill set possible.
State officials say that colleges will go back to in-person teaching this fall. What steps is USF Health taking to make that transition from remote back to in-person teaching?
We will be coming back in person, especially for our first years. When you are meeting a brand new group of 176 students, they don't know you, you don't know them. We will be following all CDC guidelines. My team is in the process of going through our entire schedule, all 1,400 sessions for the whole year. So we will be socially distancing everybody, and the result of that is we're effectively losing half of our footprint in space. We'll be using Teams to mitigate that. So what we're going to do is survey our students, find out who really wants to be in person, and then for those sessions, get a 100-person classroom, let the 30 or 40 that really need to be in person with the faculty. And then everybody else who didn't really want to be there in person anyway and wanted to be at home in their pajamas can be at home in their pajamas. And then we save the space for the sessions that really need to be interactive and you need to have your butt in a seat to be able to execute the curriculum properly.
How have the students responded to that?
I can tell you, I am ridiculously proud of our students. They have been troopers. This is a very intimidating time for all of us. It's a very scary time for all of us. And so you take that anxiety and then you have to completely change how you're learning. They've really weathered it very well.
Thank you for joining us for this week's episode. Tune in next Tuesday when Allison Long sits down with USF Health Associate Vice President of Research, Dr. Stephen Liggett, to discuss the research USF Health has been involved with since the start of the COVID-19 pandemic.